one thing you cannot escape when it comes to the NCLEX is what I want to show you now. But before I get straight into it, now let me explain this concept so well so that you understand what we're about to talk about. Right. So now this is it. Now let us say you have a phone, right? Let's say you have a phone that got bad. Now you want to fix the phone, right? Now you are going to take this phone to a phone repairer, somebody that like fix phones, right? Now guess what? When you take this phone, right, you are like, let's say this is the phone repair right here, right? This is the phone repair guy right here. Let me just give him a face cap, right? Right. This is the phone repair right here. Now, see something, right? When you hand over the phone to the phone repairer, right? Guess what? You are like, oh, my phone went bad. I don't know what is wrong. Now, the phone repairer is going to collect the phone from you, take it inside, fix it, bring it back to you. It's working, and then you are happy about the situation, right? Is that not how it works? Now, you don't even have any question to ask, like, oh, what happened to the phone? How did you manage to fix it for me? Right? Because initially, you knew your phone was bad, right? And you knew the only person that can fix it for you is the phone repairer. So you already know if you take your phone to the phone repair, you're going to get what? A solution. Right. So now, that's the same concept that work with the nurse and the patient. Now, when the patient come and they are asking you, right, maybe they are complaining about their condition to you, right? They believe that you, the nurse, have the solution to their problem, right? So you, the nurse, now have to be like that phone repairer that have audio solution to the problem. Now, let me give you a little bit about how a phone repairer can be able to fix the phone, right? A phone repairer will only be able to fix a particular phone if they know so much about that phone, right? If they know so much about that phone, like let's just say this phone repairer only fix iPhones, right? So the phone repairer needs to know so much about iPhone in order to fix iPhone. Now, you as the nurse as well to need to know so much about the client, right, in order to fix the client problem. Now, when I talk about knowing so much about the client, I don't mean a specific client. I'm not saying, oh, I know about John, so I know how to solve John problem. No, I'm talking about generally, right? Not just one client, general, any client. So client is related to anybody, not just one specific person. It's not because you understand John's situation that's why you're able to fix John's problem. No, it's because you understand one basic thing, and that one basic thing you understand is what we call what makes it work, right? Now, in this case, the phone, what make it work is everything inside the phone that make it work, that the phone repairer, right, understands so well that help the phone repairer to fix it. So now the phone repairer understand what make the phone work, and when the phone is bad, the phone repairer can now say, oh, this is why this phone is bad, right, and be able to fix it for you. Now the same thing happened to you, the nurse, and your patient, right? Regardless of who, right, you want to know what make the body work, right? That when the patient make a particular complaint, you can directly go to that particular thing and get the problem. Now, there's a special way the phone repairer will tend to understand what get the phone to be bad or got the phone to be bad, right? Same thing, you, the nurse, want to understand what got this patient but to be complaining what they are complaining about, right? So now let's leave the phone repair alone. Let's focus on how can the nurse know what is wrong with the patient. Now we use two things. Now one okay, these two things come from understanding one major thing, which is how the body work, right? The body work through what? The body systems, right? Now the moment you understand the body system so well, you know about the the patient, right? You know about the patient. The moment you understand the body system so well, you know about the patient. It's simple. It's simple. It's just like right now, if I'm using one phone to record this my laptop screen right now, and this is my other phone. Right now, guess what? If this phone, let's say I'm trying to like press the screen and it's not working, right? Guess what? The reason why it's not working is because probably the screen is bad, right? The screen is bad. Though the screen is not bad, but I'm just trying to say the reason why it's not going to work is because the screen is bad. Right. Now, I can easily know that, oh, my screen is not pressing because the screen is bad. Now, so if a patient come to you and they make a particular complaint to you, guess what? Based on that patient complaint, you should be able to identify what body system is the problem. Right. It's just like now, when I'm pressing my screen, I'm not saying, oh, it's because of the back of the phone that is not making it to press, or it's because of the pouch. I'm not saying it's because of the pouch or any other thing. Instead, my main reason why it's not pressing, right, is because the screen is bad, right? That is what I will be thinking. I cannot think any other thing. Same thing with if a client complains of shortness of breath, you should be able to identify that, oh, based on my understanding related to the body system, it's the respiratory system that is affected. That's why the patient is having shortness of breath. I cannot say that is the neurological system that is affected. Why? Because shortness of breath is not a sign and symptom of the neurological system, right? Shortness of breath is a sign and symptom of the respiratory system. It's only when the respiratory system that is affected that the patient can have shortness of breath. It's only the respiratory system that is responsible for shortness of breath, right? So now you see, I'm able to say shortness of breath. If a patient is confused, right, what body system are you going to say is affected? Obviously, the neuro. If a patient is having high blood pressure, what body system would you say is affected? The cardiovascular system, right? You see how it works. Oh, patient complain of what? Constipation. Let's just short it. Constipation. What body system is affected? The GI. You see, a patient complain of nausea and vomiting. What body system is affected? The GI. You see, every patient complaint is always related to one body system because the body system is what keeps the patient alive. So when we are trying to answer NCLEX question related to acute or chronic condition, always remember that this is your main goal, right? Everything you are trying to do, right? Everything that you are trying to do on the NCLEX exam related to acute all come back to attack your knowledge related to the body system. Now, the problem is a lot of students don't even understand the body system. That's the reason why they will keep struggling on the NCLEX exam. Right. We have 10 body system. Let me help you with them so that you can be able to for the NCLEX exam, I'm telling you what you need to know for the NCLEX exam. If you go online, you will see more than 10, but forget. I'm giving you what the NCLEX wants you to know. Right. I want to give you what the NCLEX wants you to know real quick. Right. NCLEX wants you to know this, right? The biggest one, which I call them the level 1, I have my reason why for putting them in level 1, is cardiovascular neurorespiratory, right? CNR. Level 2, right? I will explain why. Level 2, we have the GI, immune system, renal system, endocrine, right? Now, level 3, right, we have the musculoskeletal, reproductive, and then we have the skin, also known as integumentary, right? So now we have 10, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right. So this is what you need to know for the NCLEX exam. Now, the reason why I created this level is because when you are trying to prioritize, right, we always used to say, oh, when you are trying to prioritize, we always used to say, who is going to die first? Now, in order to know who's going to die first, right, this is how the patient can die. Right. Now, if this 3 body system is not affected, now I can tell you something for sure. Before a patient can die, right, one of these 3 body systems need to be affected. GI cannot kill the patient alone. GI need to affect one of these 3 body systems to die. The immune system, right, anything that is affecting the immune system cannot kill the patient alone. It must affect these 3. These are the body systems that are responsible for the patient to be alive. Cardiovascular, neuro, respiratory. These are the body systems that are responsible for keeping the patient alive. If the neuro is bad, patient is gone. If the cardiovascular is bad, patient is gone. If respiratory is bad, patient is gone. With GI, you can still live for a long period of time before you will die, right? Because GI have to come to affect this before the patient die. Immune have to affect this before the patient die. Renal system, endocrine, musculoskeletal, reproductive, skin need to affect these three body systems before the patient will die, right? Except if this patient have direct trauma, right? Aside that, if it's a disease process, every of these disease process along this level 2 and level 3 need to come to affect the cardiovascular, neurorespiratory before the patient will die. So now you have a clear idea now how to prioritize, because now when you are trying to prioritize and then you have a patient that is having social condition and then you are trying to think about who is going to die first, right? And they are telling you a patient who have asthma, having shortness of breath, and a patient who have COPD, right, and is confused, right, having shortness of breath. Okay, let me just put this. Asthma, having shortness of breath, and the patient who have heart failure, shortness of breath, and confused, right? Guess what? If you are going to prioritize this, right, you always used to apply ABC, airway, breathing, circulation. Now, when you want to answer this question, you will say, this is your answer right here. But guess what? This will never be your answer, right? The reason why this will not be your answer is because, one, this is shortness of breath. Obviously, is related to the respiratory system, one of those body systems that can cause the patient to die first, right? But now, if you notice this one, right, this is shortness of breath, but it's related to the respiratory system. Now, this is shortness of breath, but it's not related to the main source that we believe shortness of breath should be related to, which is shortness of breath should be related to the body system. You see, I said every of your questions are all tied back to the body system. Now, guess what? Shortness of breath is not related to like, it's not related to cardiovascular. Shortness of breath is related to respiratory. So my question is, why is this patient having shortness of breath? It means that this cardiovascular have started causing a respiratory problem. Now, they did not only say shortness of breath, they said the patient is confused. So the patient have started having shortness of breath, and which is respiratory and neurological problem. Now, this patient have a cardiovascular problem right here, respiratory, neuro. So like, three body system is affected. And this one, we only just have one body system affected. The condition is respiratory. Shortness is respiratory. Now, who do you think will die first? Obviously, this patient before asthma. So that's the reason why heart failure will be a priority. Like the patient with heart failure, shortness of breath, confused will be a priority, right? So this is how it works, right? Now, this is how it works in the sense that you want to understand the body system. Now, let me tell you what you need to understand about the body system, right? This is what you want to understand about the body system. You want to understand the function, right, the organ, or you can call it also the structures. Very important. Like, let me give you an example. Let's say we are talking about cardiovascular now. So cardiovascular is a body system. It's one of the body system used for carrying blood, oxygen, heat, right, a lot of things, right, circulate the blood around the body. Now, organ, we have the heart, we have the artery, we have the blood vessel, we have the blood component, right, the blood and its blood component. That's what we have, right? So now that way you are clear. Now you are clear about the function of the heart, the function of the artery, the function of the vein, right, the function of each of those components of the blood. That way, when NCLEX is testing you about a particular question and the NCLEX is not telling you a patient have low platelet, right, low platelet count. Now in your mind you are not like, oh, I know the function of platelet help us to avoid bleeding. Now you are not saying that a patient have low platelet. Now in your mind you are not like, oh, this patient have low platelet, so this patient will be at risk for bleeding, right? So now you will pay more attention to this patient because you know the danger related to this, right? You see how it works, understanding just that body system. Now, you also want to understand in a sense that you can link sign and symptom related to each body system. Like now, if the NCLEX tell you a patient have high capillary refill, right? Let's say they say capillary refill 3 seconds, right? In your mind, you are like, oh, this capillary refill is too much, right? Now, you understand the symptom capillary refill. So you are now like, oh, capillary refill, the it's high because we need less than 2 seconds, right? It's high. And capillary fill that is high means that the patient is having perfusion problem. So you are not like, oh, this patient have perfusion problem, we don't want this for the patient because it's going to cause problem to vital organ. It's a concern, right? You see all these things will start making you know what is concerning. We start making you understand the patient situation and every other good stuff. It all starts from the body system. But now I'm trying to drive you to one part, which is the two things I said you need to know from the body system. Is that when the body system is affected, right? How do you know as a nurse when the body system is affected? We use two things, right? We use two things. Now, the first one that we use is vital sign. The second one that we use, we call it head to toe physical assessment. Right, head to toe physical assessment. This includes you assessing all the body systems. Right, this includes assessing the 5 vital signs. Right. So now the head to toe assessment is not what I want to talk about. This is what I want to talk about, the vital signs, because for the NCLEX exam, you need to know the vital sign for newborn and you need to know the vital sign for adult. Right, because that way you can be able to detect the problem. Now we have 5 of them. We have the blood pressure, we have heart rate or pulse, right? We have the respiratory rate, we have oxygen, and we have temperature, right? So I'm going to use it for the 2. Right, now the blood pressure is 100 over, please pay attention to what I'm giving you, right? Because you might have seen a different thing before, but I'm giving you what you should know for the NCLEX. So this 100 over 60, 120 to 120 over 80. So this is your systolic, this is your diastolic. Right here, the blood pressure is 60 over 40 to 80 over 50. That's for newborn, right? The heart rate is 60 to 100. Right here, the heart rate is 110 to 160. Right, the respiratory rate is 12 to 20. The respiratory rate here is 30 to 60. Right, the oxygen is 95 to 100%. Here it's also the same thing, 95 to 100%. Right, the temperature here is 97 to 100.4 degree Fahrenheit. Right, the same thing as well, to 97 to 100.4 degree Fahrenheit. Right, so pay attention to this because what I have given right here is related to what the NCLEX wants you to know. Right, so know this for the NCLEX. Right, so you want to know why the vital sign is abnormal. Right, now blood pressure, heart rate is related to cardiovascular system. Respiratory rate, oxygen is related to respiratory rate here, oxygen is related to the respiratory system. Right, temperature is related to every body system. Temperature, any body system can cause the temperature to be high. Right, you can have GI infection, temperature is high. You can have neurological infection, which is also something that can cause the temperature to be high. Right, you can have skin infection, temperature is high. Like anything can cause temperature to be high. So temperature is not related to just one body system. That's one thing you need to know. Right, so you want to know, it's just like now, if NCLEX is telling you the patient heart rate is high, you always want to pay attention to what the blood pressure look like, because sometimes the patient heart rate can be high because the blood pressure is low. Right, same thing with the respiratory rate. Respiratory rate can be high because the oxygen is low. So when the NCLEX is telling you respiratory rate is high, you also want to pay attention to the oxygen as well too. Right, so that's one thing you want to know. And temperature that is higher than this shows sign of infection. Right, so there are 2 reasons why patient temperature can be high. It can be related to inflammation. It can also be related to infection. Like a patient 24 hours after surgery, right, and temperature is high, that is not an infection, that is inflammation. But 72 hours after surgery, patient temperature is still high, that is when we consider that an infection. Right, also when you come to oxygen for COPD patient, oxygen for COPD patient is 88 to 92%. So know that it's a different oxygen range. Right, a patient that don't have COPD is 95 to 100. Right, but a patient that has COPD, their oxygen range is 88 to 92%. Right, also we always used to talk about pain as one of the vital sign, but let's talk about pain. Right, but it's not really part, but we always used to consider it most times when we are doing like head to toe assessment. So pain on the NCLEX exam, right? The scale is 0, 1 to 10. So 0 means no pain, 1 means the lowest amount of pain, and this is like the highest amount of pain, right? So 1 to 3 is mild, 4 to 6 is moderate, 7 to 10 is severe pain, right? So just in case you are like having a particular question, it's a prioritization question. Now, one thing about pain as well too is that pain is not related to one body system, right? Pain is not related to one, same way temperature is not related to one body system. You can have head pain, neurological pain, you can have cardiovascular pain, you can have chest pain, right? GI, which is abdominal pain, right? You can have fracture and have pain. So pain is related to every body system, same way temperature is related to every body system, right? So but one thing you want to know about pain, let us say NCLEX is asking you to prioritize clients 1, 2, 3, 4, and then they tell you your pain is a patient is having pain of 4/10, right? Just X this out, because every other client will be so important, will be very important than this client. You start considering pain as part of your priority when it's above 7, right? Anything from 7 to 10, that is when you start considering pain. But anything less than 7, no, we are not considering pain when we are trying to prioritize, because there are patients that will have serious issue than dealing with pain of 4 or pain of 6. No, it's not going to be a priority. But if the patient now, the NCLEX is now saying the patient have pain of 7, this is when we now start considering it among the list of priority. Then we now look at patient 1, patient 2, patient 3, patient 4. But if it is just less than 7, just exit out. Don't even give yourself stress. Focus on the remaining 3, right? So this is what you need to know related to vital sign, and I'm going to see you in the next one.